they also have the diabetes, maybe under control, but not cured as a whole. But in order to take care of that stress part, whatever we do, maybe they will be doing for an hour or two per day exercise, physical activity, but they will be engaged throughout their daily chores, and which makes them more stressful. And to take care and cater that, I think the Reiki will be one of the best option for taking the stress level down. And as I said, these are all the few types of diabetes sugars. It showed high, HIGH, which means it will be more than 600. We have would have seen 150, 200, 230, like that would have seen. But if the glucometer, the device shows high, means it is more than 500 or 600. It will not display the number. It will just show high. And we were not sure whether it was a diabetes or type 2 diabetes. So when the results have come, we came to know that it was negative, and we were still in the confused where we were not able to conclude what condition is he having. And later on, when we started the treatment, immediately the sugars came down after a week or so, and then we came to know that the results have come as negative. We concluded that he was in type 2 diabetes, which was shocking to every one of us. Why I'm saying this is, for a child who is doing his 10th grade, who is having type 2 uh, is not very usual, because that comes for a person who is physically inactive and the insulin is not working after a certain period of years, maybe in his late 40s or late 50s. And we came to know that we took the detailed history about him, and we came to know that he is in 10th standard. He's been put to too many number of tuitions from after his school, 5 to 6 French tuition, 6 to 7 max, science, still 10, 10, 30, he's having tuitions. And he is having his board exams, I think, in coming Feb, I guess, if I'm not wrong. The 10th board exams are coming up, and he's been pushed beyond his limits. And we came to know that his beta cells is nothing but the cell which is there in the pancreas, கணையம்னு சொல்லுவாங்க தமிழ்ல, where the insulin is being produced, which helps us to reduce the blood sugars as well. We came to know that in his pancreas, the beta cells are shut down. We call it as stunning of beta cells. This happens due to a high level of stress. On the other hand, his lifestyle is also not that great in his food habits and other physical activity as well. He was little obese, but that is not because most of the children who are going to in nowadays school, I think um, majority of the population is becoming in an obese category when compared to last 10 or 15 years ago. That was not the criteria to tell that he is having diabetes, but we did some extra tests, and we came to know that his beta cell has been shut down, which is totally because of his stress. When he came to hospital, we gave so many of counselings. He had no tuitions at the period, in the mean period, and his sugars came down normally. Gradually, it went down, and we finalized that it was because of pure stress. So in those scenarios, I think we need to cater those scenarios through stress reducing through any Reiki or yoga, something. We have to treat it at the root level cause. We can't just insulin just to bring down sugars, because we can control the sugars at that time just by giving the medications. But when he goes back to home, maybe he may take the medication or he may not take. We are not sure about that. But we have to develop a lifestyle where we need to inculcate all this stuff as a daily habits, like how we eat, how we sleep. Like that, we need to do certain sadhanas or certain Reiki healing process in order to keep our stress level down. Because what happens is, can you just please go down now? Yeah. So as we all can see here, yeah, this picture depicts what the stress can do to our health. Stress is nothing but when the stress is too much in our body, the cortisol level in our cortisol is nothing but a stress hormone. In ages during our stone age, where we hunt the animals, what happens is, when we see a tiger or when we see any animals in the jungle, we have to run first. For that, our body reacts through secreting this hormone called cortisol. That is a hormone for what I would say. We call this a fright, flight, and fright mode, where we have to run first and we have to save ourselves. This cortisol hormones will increase our sugar levels because when we need to run, we need energy. For that, our body will secrete more sugars, and that cortisol level. But in today's time, what happens is when we see our bosses in the office, our cortisol level shoots up, and we won't be able to run away from our boss. We have to sit there and we have to work it. So what happens is our cortisol levels will keep on increasing, and how we will be able to bring down that stress level and how the sugars will be utilized by our body. And if this situation, we call it as a glucotoxicity, which is high levels of sugars will be present in our blood for a very prolonged time, which will not show any kind of typical symptoms in order to get a medical help at that time. It will show after many years of that glucotoxic levels will be there in the blood for many years. Once the symptom starts, it is too late and too little to intervene it. So here you can see it will suppress our immune. It will decrease the sensitivity to pain, which will be experienced as numbness in our bodies. A person who is having diabetes and high sugars due to this cortisol, due to high stress level, we won't be able to perceive the pain as well, and there will be an increase in the blood sugar, increase in the blood pressure as well. So all these things will contribute high blood sugar, and that will lead to acute and long-term complications. Can go back to the slides that we were discussing before on the top. So after type 2 diabetes, this is the stage where we've been diagnosed, and there is a stage called pre-diabetes, and that's the double the population of the type 2 diabetes that has been there in our Indian population, where, as I said, the young population, the school going, the college going students who are being diagnosed with before the type 2 diabetes. Here we don't need any kind of treatment. Usually we don't give any medications for this. Here we purely advise only lifestyle modifications. And I also have a formula where I've just developed uh, to prescribe to the patients. I call that formula called Ferries. We will be coming to that part later, which is called F is for food, exercise, and Reiki I've also included in that, because I've been practicing for past few years now, a couple of years. So I also recommend this to the patients, like yoga as well, and proper good sleep, which will bring down your sugars. I mean, the stress level, which will indirectly have an impact on sugars as well. The next slide discusses about the type 1 diabetes, which is an autoimmune condition. Still, we don't have a in this situation, the beta cell, which I've been mentioning to you just before a couple of minutes, the beta cell will not be producing any insulin in our body. The pancreas will have beta cells. The beta cells will not produce any insulin hormone to control our sugars. In this scenario, we have no other option other than giving insulin. Not even the tablets, only insulin has to be given for this kind of, and this is mostly developed age group, and they may have till their end of your life. And most importantly, there is a gestational diabetes. This is nothing but the diabetes during the pregnancy time. And during the pregnancy time, we need to have a very good lifestyle, where that in Indian tradition, the work we do, and so many other things. But we also need to incorporate certain stress lowering habits like Reiki and yoga, which will bring down their sugars and keep it in control, because here is a situation where they have complications for both mother and the child in the womb. So that we need to be very careful in these scenarios. The other things are all because of so many other lifestyle habits, like a person who take alcohol or so many other substance abuse. They will develop so many other medical conditions that will lead to diabetes due to organ failure. That is a totally different category where they develop the diabetes. This is called LADA and MODI. All these are type, which comes under the type 1. Autoimmune, I hope everyone will be knowing what autoimmune is. Autoimmune is nothing but, I will just give you a recap of what autoimmune is. Autoimmune is nothing but the immunity in our body will be against our own body's immunity. அதாவது நம்மளோட உடம்புல ஸோ நம்மளுக்கு ஹெல்ப் பண்ணாது. ஸோ தட் இஸ் கால்ட் autoimmune conditions. There are so many other conditions. There are so many conditions in autoimmunity, but here I'm just explaining only about the diabetes alone. And here comes the neonatal diabetes, which is nothing but the babies who get diabetes. And unfortunately, that will be a very difficult situation to accept both for the families and the mother. So what causes diabetes is nothing but the hormonal irregulations, the lifestyle, and the increased stress levels. All those things will be leading to diabetes, and these are all the long-term complications where we have been going through. We don't know the underlying cause actually. The most of the I mean the heart attack, the stroke, we get not only because of the dysregulation of the blood supply to the heart and the brain. It is also the underlying cause is the sugars. The high amount of sugars will cause obstruction in our blood vessels. நம்ம நிறைய சுகர் இருக்கும்போது நம்ம உடம்புல வந்து ரொம்ப வருஷமா அதே மாதிரி இருக்கும்போது என்ன ஆகும்னா நம்ம ரத்த குழாய்கள் வந்து அடைப்பெடுப்பிடும். அது வந்து அதுல கொழுப்பு சேரும். கொழுப்பு சேர்ந்து அந்த கொழுப்பு கட்டி வந்து வெடிக்கும் போது அதுல நம்ம ரத்த அணுக்கள் வந்து கிளாட் ஃபார்ம் பண்ணும். நம்ம யூஸ்வல் நம்ம முட்டியிலையோ கையிலையோ அடிபட்டுச்சுன்னா எப்படி பிளட் கிளாட் ஃபார்ம் ஆகி வெளியில பிளட் ஊஸ் ஆகாம பாத்துக்குதோ அதே மெக்கானிசம் தான் நம்ம ரத்த குழாய்களையும் ஹார்ட்லையும் பிரெயின்லையும் நடக்குது. ஆனா அந்த இடத்துல நடக்கும்போது என்ன ஆகும்னா அது வந்து அடைப்பு ஏற்படுது. நம்மளுக்கு வந்து அந்த குழாய்கள் ரத்த குழாய்கள் வந்து அடைப்பு ஏற்படுத்தக்கூடாது. ஆனா அந்த மாதிரி ஏற்படுத்தும் போது தான் நம்மளுக்கு வந்து ஹார்ட் அட்டாக்காவோ இல்லை வந்து ஸ்ட்ரோக்காவோ அது வந்து ரெப்ரசென்ட் ஆகுது நம்மளுக்கு வெளியே. ஸோ அதுக்கு வந்து ஒன் ஆஃப் த மோஸ்ட் இம்பார்ட்டன்ட் காஸ் இஸ் ஹை சுகர்ஸ். அது வந்து ஹை சுகர்ஸ்ங்கும் போது இட் வில் பி தேர் ஃபார் லைக் 5-10 years. அது வந்து இமீடியட்டா நம்மளுக்கு எஃபெக்ட் பண்ணாது. இட் வில் டேக் இட்ஸ் ஓன் டைம் டு கெட் டு that position. And most importantly here in my hospital, food cases, which is nothing but food ulcers form ஆகும். அதாவது due to high sugars what happens is our nerves gets damaged. அந்த nerves gets damage ஆகும்போது நம்ம உடம்பு நம்ம கால்கள் வந்து மறுத்து போயிடும். அதாவது நம்னஸ் கிரியேட் ஆகும். அது வந்து நம்மளோட பெயின் பர்சீவ் பண்ணாது. அதனால என்ன பண்ணாங்கன்னா எங்களை இடிச்சுக்கிட்டாலோ இல்லை எங்கேயா கட் வூண்ட்ஸ் ஆனாலோ அது வந்து அவங்களுக்கு வந்து தெரியாது. ஹை சுகர்ஸ் இருக்கிறவங்களுக்கு சொல்றேன், ரொம்ப வருஷமா மறுத்து போகும், கால் எரிச்சல் இருக்கும், பாத எரிச்சல் இருக்கும். அதெல்லாம் வந்து அந்த சர்க்கரை நோய்க்கான ஒரு அறிகுறிகள். அதெல்லாம் அது லாங் டர்மா இருக்கும்போது எங்கேயா குட்டியா அடிப்படும், அது உங்களுக்கு தெரியாது. அதுலேயே ஆனால் அவங்க நடந்துட்டு இருப்பாங்க, செருப்பு போட்டு ஷூ போட்டு நடந்துட்டு இருப்பாங்க. அந்த மாதிரி நேரத்துல வந்து அந்த புண்கள் வந்து நம்ம ப்ராப்பரா கேர் பண்ணி அந்த நேரத்தில் நம்ம கிளீன் பண்ணாம விட்டோம்னா அந்த மாதிரி வந்து அது என்னன்னா ஆம்புடேஷன் பண்ற ஸ்டேஜ் வரைக்கும் போகுது. இல்ல பாதி பாதம் இல்ல ஈவன் பிலோனி ஆம்புடேஷன் சொல்லுவோம். அதாவது பாதி கால் வரைக்கும் நம்ம வந்து ஆம்புடேட் பண்ணி எடுக்கிற அளவுக்கு வந்து இன்ஃபெக்ஷன் வந்து ஸ்ப்ரெட் ஆகக்கூடிய சிச்சுவேஷன்ஸ் எல்லாம் we have been seeing here. அது வந்து பாத்தீங்கன்னா அவங்க post surgery lifestyle will be very it will be very difficult for them to accept. இத்தனை வருஷம் நல்லபடியா நம்ம நடந்துட்டு இருக்கவங்களுக்கு வந்து அந்த மாதிரி நேரத்துல வந்து அவங்களுக்கு அந்த ஸ்ட்ரெஸ் லெவலுங்கிறது ரொம்ப அதிகமா இருக்கும். மன அழுத்தங்கிறது ரொம்ப அது கொஞ்சம் ப்ரிவென்ட் பண்ணும். அதாவது சரியா ஹீல் ஆகாம போகும். அந்த மாதிரி நேரத்துலலாம் வந்து we need to incorporate to the நம்ம வந்து வலி இருந்துச்சுன்னா வலி மாத்திரை தருவோம், சுகர் இருந்துச்சுன்னா சுகர் மாத்திரை தருவோம், ட்ரெஸ்ஸிங் பண்ணுவோம். பட் வந்து அவங்க மனநிலை அளவுக்கு நம்ம போயிட்டு ரூட் காஸை போய் பண்றோமான்னு கேட்டோம்னா which is not there in our traditional healthcare setup. And that is where our holistic health approach should play a vital role. So I've just developed a formula called, I've said the fairies. Fairies is nothing but F-ங்கிறது நம்ம பார்க்குற மாதிரி food, E-ங்கிறது we call it as an exercise. I've also included the Reiki. For the past 1 year, I have been doing this to my patients as well. I also always recommend to try to do something regarding the Reiki as well. And yoga is also there, and good sleep. So all this together, I think that will help the patient a lot rather than just prescribing them a pill. On the title of Holistic Path to Patient Health, the first principle that I have been taken in my hand is the patient education. அவங்களுக்கு முதல்ல வந்தாங்கன்னா உங்களுக்கு என்ன சிம்டம்ஸ் இருக்குது அப்படிங்கிறது தெரிஞ்சுக்கிட்டு we need to acknowledge about the patient's overall history and his background and everything. And I also tell, do you have you tried any other things apart from physical activity, exercise, diet, medication, which we all know it. அது வந்து பெரும்பாலான மக்களுக்கு வந்து நல்லாவே தெரியுது. ஆனா அதை தவிர்த்து உண்மையிலேயே வந்து ஒண்ணு இருக்குது. I also share my anecdote experience, my own experience about the Reiki and how I have been benefiting from that. ஸோ அது வந்து அதையும் நான் சொல்லி காமிப்பேன் சில சில பர்சன்ஸ் வரவங்க என்கிட்ட வரவங்கள்ட்ட. ஸோ அவங்கள்ட்ட எல்லாமே சில பேஷண்ட்ஸ் வில் பி வெரி ஈகர் டு நோ. ஸோ ஃபார் தெம் ஐ ஆல்வேஸ் சஜஸ்ட் டு ட்ரை அவுட் திஸ். And where we need to express our recognition and importance of the holistic well-being, acknowledging the mind-body connection in health. Because number one, it is not just a physical body, it also something also called metaphysical, as you already know it, where we need to have some connection with that. The aura cleansing, chakra cleaning, everything has to be done in order to get the better health. Here, the complementary approaches in diabetes shows the potential role for complementary approaches, just Reiki, as a part of the comprehensive management. In my practice, I practice good results because some of them will say the stress levels have been reduced, especially the friends of mine who are typically working in front of the computer from home culture now. I always ask them to do those things. Some of my few friends, I just go and கை போய் பிடிச்சிப்பேன். ஸ்ரீதேவி மேம் அப்படி எங்களுக்கு சொல்லி கொடுத்தவங்கள அதை ஜஸ்ட் ஐ ஹேவ் do that, and they may feel little bit better. Actually, I know what magic is that, but it helped my friends as well. Here I've done this part. I've already explained this to you regarding the integration of Reiki with the conventional medicine for encouraging an integrative approach to health, where the Reiki and the conventional medical treatments work together to optimize things for the better outcomes for the individuals with diabetes and other medical conditions as well. தன் கை தனக்கு உதவின்னு சொல்ற மாதிரி நம்மளோட வர மக்களுக்கு வந்து அந்த செல்ஃப் கேரை வந்து பியாண்ட் சர்டன் சிம்டம்ஸ் திங்ஸ், some high power is there. And I think it's been well designed by Dr. Salita ma'am, that tool that she has given to us, and I'm sure that if we make use of the tool, that will be more beneficial to them. So I'm in that part to preach that to my people. So promoting the positive life, healthy lifestyle changes, and this is my formula that I've developed. It's a very simple thing. It's the same concept only. I just came up with a comprehensive word called fairies. F is for food, E for exercise, R is for Reiki, Y is for yoga, S is for sleep. And there is a personalized approach to wellness, the treatment care plan, and that is on top of that. I also do include all the fairy formula, and we all need to encourage the patient with an open dialogue, fostering and dialogue about the integration of the holistic approach with conventional medicine, encouraging and asking them, spending little more with the time with the patient. I think that will do a lot, rather than just asking their symptoms and just popping up a pill will not benefit a lot, in my opinion. So this is the picture of what we have discussed so far. It's this is in a nutshell, where the community is there. This is about us in the middle. We are, and the mindfulness, awareness, and all around that, moving in the body, flexibility is there, surrounding physical activity, personal development is there, and the food that we have. And we need to recharge the sleep, refresh, Reiki and other things. And relationships, which is more important, spirit and soul, and power of the mind, relaxing and healing. In order to reach that, I think the pineal gland will help us a lot, rather than just instead of taking the psychedelic drugs, we have to tap the pineal gland in order to get the same effect, which is already present in our body. So I think the Reiki will be the tool to reach there. That I have learned so far, these are the scenarios where we can assimilate the holistic approach to benefit the most of the patients in stress reduction. As we have, I think most of the discussion were about that, because at the end of the day, tablets will surely suppress the symptoms and will bring down certain chemical components. If you take the blood results, it will be in the normal side, but beyond that, we have something, some discomfort in our body, and which should be dealt with all this holistic approach to treat at the root level cause. And pain management, where it comes, it is very important that pain management, either physical or emotional pain, the post-traumatic stress, we would call it as, either before the surgery or after the surgery, and anxiety and depression who are on the psychiatric wards, and they will be the most who will be benefited through all these holistic approaches. And this is the fifth one. The fifth point that has been mentioned here is that new thing that has been coming up in Indian's healthcare system, which is called physical medicine and rehabilitation centers. We know about the rehabilitation center for de-addiction and other stuffs, but this is a new thing where the geriatric population. Can you go down a little bit, sir? The fifth point. Fifth point. Yes, thank you, sir. So here it's the physical medicine and rehabilitation center. We all know about what rehabilitation center is, but this is little bit different from the normal things that we see in our community. Rehabilitation center, we all know it as a de-addiction center and drug and de-addiction, alcohol and drug de-addiction center. But this is the most common thing where the joint and muscles were the the spinal cord injury patients. For all those people where the physical medicine and rehabilitation comes in, where they require a very long-term healthcare support, and they need more of emotional support, which is equally important. I would feel. And here it comes as scar tissue healing. The Reiki may assist in minimizing the formation of scars, and energy balancing for neuromuscular disorder is very vital for the individuals who are with nerve disorders, where it will help to channelize the energies, which may have some effect in the patient's overall outcome. So at the end of the session, I just want to conclude the patient-centered care and the self-education, patient education, as I've discussed earlier. The integration of the Reiki into healthcare setting will emphasize a patient-centric approach. It also recognizes the importance of addressing not only the physical symptoms, but also the emotional and spiritual well-being. I conclude with the quote: as we bridge the realms of science and spirit, let us remember that true healing lies in the seamless harmony of mind, body, and soul. May our collective journey bring us to a place where medicine and Reiki dance together, creating an harmony of health and well-being for all. And so I conclude my presentation with this. Thank you so much for giving me this opportunity. I Sridevi ma'am and Santi ma'am for giving me this opportunity. I take this, holistic healthcare approach in order to treat the conditions at the root level cause, to bring an overall good outcome for the patient's health. Thank you, and wishing you all a healthy and successful new year ahead.
And thank you, Dr. Bhuvaneeswar sir, for sharing your experience in a very down-to-earth manner. Actually, it is very encouraging to see allopathic doctors like you support and endorse this healing system. Very nicely, you briefed about different types of diabetes and which is need of the hour. The way you treat patient is also very applaudable. So you are real ambassador of Reiki. These days, no doctors like to have recurring patients, but your approach to really help and rectify the people's problem in the root cause is something really applaudable. So you are doing a very great work, and you are indeed a very good soul. I want to really appreciate that for you. So there's a lot of no doctors like you who are needed in this society. So thank you. We really appreciate your work, and we have had a very apt chief guest today. Thank you so much for joining us today. Thank you. We request you to launch the Healing Hand magazines virtually, sir, so we can see the goodness of your soul. At the reflection period. Thanks. Thank you.